This is SG2 Perspectives, a conversation with SG2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
Access continues to be a major place where organizations are looking to make a mark. Also, in sight of care shifts, better understanding how to deal with the acuity at different levels, how to deal with care at home, how to think about ASCs. All of those evergreen topics continue to plague our health system organizations. One thing I've been brought in to speak on more this year than I have in years past is this squishy word that we call systemness.
Welcome to SG2 Perspectives. I'm your host, Trevor DaRin. I have two of my senior colleagues, Brian Esser and Rebecca Limestall, who lead our strategy practices on the SG2 intelligence team. This time of year, there's often a lot of kickoff, year ahead outlooks for leadership teams, boards, etc. They've been on the road doing a lot of those, and so I wanted to hear what teams are talking about at the beginning of 2025. Rebecca, I'll go to you first. I've definitely heard systems distracted and unable to think about other growth opportunities because of federal policy uncertainty. Have you heard the same thing? How are systems trying to plan around that? Do we have suggestions or ways SG2 can help?
It's been fascinating as we've gone across the country how much or how little in different markets they might be focused on that or distracted by the federal policy. Brian, I'm sure, will give us some advice on separating news from noise that's highly variable. I have had the opportunity to follow a couple of government relations, government affairs folks while I've been on site. And so hearing what's top of mind for them and how they're handling that within the systems. What's interesting is that the federal level Medicaid is going to be one of the biggest things that they're talking about. There's other factors too to consider, but that's one of the biggest ones. The other areas that I wouldn't lose sight of are the local implications. Whether we're talking about Indiana and some of the House bills that are there with percentage of Medicare reimbursement limits, or in New York, where they were talking about the way that New York City and New York State get along or do not when it comes to politics and policy. Those are some of the things that folks are paying attention to, and it's easy to get sucked in, but making sure that we think about it with a very logical and scenario planning mindset.
Brian, have you heard the same thing or anything different?
There's a lot of noise going on across the industry on multiple topics, but not a lot of clarity. And that's something our DC colleagues here at Vizient continue to reinforce. Nothing has been fully baked and is put down and written into law and or regulation or rule-based dynamics. We're still in this gray zone of what may come to pass across the big topics like Medicaid, site neutral, NIH funding. There's all kinds of big elements out there, but between Congress and the courts and the administration, not a lot of clarity. We're seeing a lot of acknowledgement at the senior levels, board and the C-suite, and being very attuned to the federal and state dynamics. So I think it's that kind of nimbleness that 2025 will require. Secondarily, I had a good call this morning with one of my friends at Kaufman Hall, where she reminded us that 2025 is probably going to be a solid year financially for most organizations. There's several out there that are still trying to scratch break even, but we have seen the percentage of hospitals losing money in a negative margin situation come down. It was at 50% in 2022. It's at 37% through 2024. So we've seen an overall improvement in margins across the country. The reality is 2025 is probably going to be a bit more stable, with the acknowledgement that 26 and 27 are likely to be rocky as some of these changes start to actually take root. So using 2025 as the bulwark to focus on cash flow, focus on reserves, days cash on hand, really making the balance sheet as healthy as possible is going to be super important over the next 12 months.
You lead our research on financial trends overlap with strategy and planning. This time last year, margin performance was top of mind for most health systems. And ultimately, at least most that I worked with hit their budgets last year and made some pretty steady improvements, at least for like mid and larger size health systems. Is that outlook across the board? Is that because any policy changes probably wouldn't hit until the following year? How are systems talking about financial performance right now? Are they expecting to continue to improve, or that they're at a more sustainable place now than they were last year?
It feels like it's more sustainable than it has the past few years. The pulling out of the COVID pressure definitely played out through 2024 into 25. And if we look at some of the metrics, margins seem to be healthier, but we know there's still a wide variability. The haves and the have-nots continues across the markets. There's the recognition that volumes have returned. Revenue quality is probably stronger. We've worked a lot of the contract labor out of the system. Some of those elements, those pressure points have receded. It's a better overall financial picture for most organizations. The focus on cost, operational rigor really matter. I was just with one of our national systems and one of their biggest regions. The key theme to 500 of their core leaders was that costs matter. And it's that individual responsibility of each team member to focus on costs and make the operations as efficient as possible, focus on productivity, reduce costs where we can to drive margins as positive as possible, while keeping an eye on those outlying dynamics that could put pressure on the organization next year. Rebecca, what are you hearing?
From the strategy perspective, that strategy now has a place in this world of narrow margins, but we do have margins to play with here. What strategy leaders have to do is be more precise and prescriptive in their focal points, because we only have a chance to place a couple of big bets. We're not going to be able to just scattershot it and be able to take on any project. We will have to say no to good ideas in favor of better ideas.
Brian, flip the coin over. How are systems that you've worked with talking about growth priorities? I've heard two things that are not totally unrelated, but pretty distinct. And one's around recruiting precision. Can we actually start to understand the patterns of how different a retiring provider is from a new provider, how that's going to change their FTE expectations? I'm mostly talking to systems about those patterns in primary care in some smaller markets. I've talked to them about specialty too. Systems are getting stricter about how they think about backfill recruiting, and research we've done this year, Brian, think about that in terms of physician alignment and a new vision for their physician enterprise. The other piece I've heard, and this probably isn't a surprise, that systems are continuing to invest in is their digital front door. Whether AI scribes isn't quite part of that, but it's kind of adjacent and it's going to get there and it's just becoming table stakes. But thinking about stuff like the inboxologist, managing communication through the patient portal, and thinking about virtual as the default for new patient visits, because it's a shorter visit, you establish a bit of a relationship, there's high no-show rates, that kind of thing. Systems are experimenting, low-cost, quick, rapid testing in this space because they know access is still a problem, even though we've made pretty good progress recently. Brian, I'm sure you've heard similar or maybe different growth priorities.
It's still the core formula that we've laid out in the past. How relevant are you to the stakeholders in your ecosystem? And Rebecca's done a ton of good work here on the consumers and understanding what do they need, meeting them where they're at and understanding and anticipating those needs. But that's only one overall stakeholder. You have your community, and how are you viewed by the community? Is your not-for-profit status warranted? And we saw a lot of dialogue around that earlier this year. Seems to have receded a bit, but how does the community view you? And are you held in the esteem and regard that you would like to be? How do your payers view you? Are you essential to their book of business and selling product in the market? And we saw a lot of that drama within Medicare Advantage last year, continues to play out, but it seems like that's continued to be a pressure point on relevance. And then overall, your workforce. We did a discussion earlier this year. How relevant are you to your workforce? Do they believe in the vision and mission that you're trying to hold out as an organization? And do you have that cultural buy-in to move forward on all the strategies you're trying to deploy? Diversification is going to be key. I've heard one organization just a couple weeks ago say, we're also thinking about alternative revenue again, alternative revenue back in the mix, even on the academics, as they see pressure from NIH and other funding sources on the academic and research side. What does that mean on a funds flow basis for the medical centers? And is there an alternative revenue play to drive new revenue, new cash flow that could help offset some of those NIH funding pressures as well? And then lastly, is scale viable? Can you steer a ship that's twice as big as you are now? And will that take which regions, which markets? How do you anticipate market upswings and catching them early before they improve and being established as a market leader? All of that is really going to play. The three ideas, relevance, diversification, scalability, continue to matter. Rebecca, what do you hear?
I'm hearing a lot of the similar topics, a lot of evergreen topics, but being faced with a little bit more precision and action. Access continues to be a major place where organizations are looking to make a mark. Also, inside of care shifts, better understanding how to deal with the acuity at different levels, how to deal with care at home, how to think about ASCs. All of those evergreen topics continue to plague our health system organizations. One thing I've been brought in to speak on more this year than I have in years past is this squishy word that we call systemness. It has a number of different titles at different organizations where they think about destination care, operating as a system, systemness itself, one, whatever organization they are at. But the idea is the same. Organizations are coming together to say, how do we distribute services most effectively? How do we make sure that we're supporting our rural communities and managing capacity constraints at our more destination centers? And how do we grow as a system and not just individual entities? There's a lot more conversation and action taking place in this regard from the board levels all the way down to frontline staff.
All right, Rebecca, what's something that you thought systems would be talking about and they just weren't? Or it's something that last year you thought was going to be a bigger deal by now, but systems just aren't moving on, aren't prioritized, just aren't talking about?
Health systems should be talking about differentiation. They are not talking about that enough. They're not talking about how do they make it easy for the customer enough. So I'll answer in a different way. There's a couple of things that health systems are not quite getting to, and that's taking those big, bold bets, doing something radically different as an organization. There's a handful out there who are doing it, but by and large, it feels very business as usual in a lot of these meetings that I attend, but with a lot more pressures from the market and national level. The other thing I've noticed is the places where I thought policy would be a major issue happened to be not the case. And places where I didn't anticipate that to be a big conversation point, it was. So I've found that the state level and the local level matters a lot. And the culture matters as to how we talk about these external pressures on the organization.
Rebecca, not enough commitment and focus on we're going to be the best at making it easy for consumers. But I have heard more acknowledgement that it has to move up the prioritization ladder. I was talking to an AMC a couple of weeks ago about the balance between their historic strengths, complex care, recruiting top providers, especially physicians, balancing that with what they know their consumers want and need and what they're trying to compete with from other local health systems around access, digital front door, et cetera. An admission that balancing those two things was going to be the challenge of the strategy function going forward. The gist I got from them was the scales are still tipped towards leaning on their traditional model. Probably not a big surprise.
I think that's fair.
How about something surprising you heard recently? Whether it was a comment in the room, something someone wanted to talk more about afterwards. I have one, but I want to hear what you guys have first.
It's the organizations that are seeing all the same things we're seeing across the industry and viewing it really from an opportunity perspective. There's a lot of turmoil out there, a lot of scary things that put pressure on every organization, be it workforce, revenue, margin. We're all seeing the same headlines. But those organizations that have accepted the reality and said, we're going to find the silver linings in these and hold ourselves out in a radically different way to the consumers, to our payers, to our communities, and use that to fuel our economic engine, whatever that may be.
Brian, you bring up an interesting point, and it's a conversation you and I had yesterday as well, that we're seeing a lot more cynics in the strategy seat than we've ever seen in the past. Strategy tends to be more of a positive role because we're always looking to the future. Also tends to be we're highly anxious folks when we think about all these future potential scenarios. We are noticing more cynics in the midst within strategy, but those that are retaining the positive vibe and being able to push the organization forward, that resilience of an organization, the focus on what you're trying to do will be the ones that will be very successful in the next year or two. The other thing that I've found particularly interesting this year is how many health systems have brought us in for helping them with change management, not in the project management office type of way or the tactical pieces, but more in changing the organization, requesting for folks at the front lines to think more strategically, to have a strategic mindset, to be able to push the boundaries and get more creative in the day-to-day. We're being asked to help do that more. That is a fun way that, particularly for positive folks and positive organizations, and as we think about the future, we can help shape that. I had the chance to do a children's hospital meeting, which are always wonderful. And I was in tears twice early in the meeting as the mother of a kiddo that had been helped by the hospital shared the story and talked about how her child not only was able to walk again, but regained his laugh. I always love those nice, inspiring moments to remind us why we do this to begin with.
Oh, that's really good. Thanks for sharing that. My surprising thing is not that heartwarming. It's just that this isn't quite a trend yet. I think it's the tip of the spear. In some big markets, Brian, in the physician alignment interviews we've did, systems started talking about, especially the bigger acquirers of physicians, the health systems are seeing a boon of physicians trying to come back to more traditional employment arrangements out of what we would call the biggest disruptors. Not something I've heard in every market, not a total pattern yet, but it's not hugely surprising. That's something I'm going to keep listening for.
We need to challenge ourselves, the position dynamic. They went to the disruptors. Now the private equity firm has sold them off. It didn't work. They're back in the market. Should we employ them or not? To me, that's a bit of a lazy discussion. We need to ask ourselves, is employment the right option here? What are the other variables? And I would say, let's expand that periphery to everything we're doing, because we hear from the employers, we hear from consumers, we hear from all these other stakeholders that legacy way of doing business wasn't working, or at least is tenuous at best. So challenge ourselves. This could be the default easy button to just bring these docs on and employ them in an RVU-based model that has maybe a tie to quality. That's one option. Or we can get more innovative in how we hold ourselves out to them using our CINs or ACOs, stacking different alignment models, all of that within that one segment of focus. But what else have we been doing that has been an easy button dynamic that the market is clearly saying this isn't working, but we're not willing to take that head on and innovate and really take the strength back away from those disruptors that are saying, oh, we'll do it differently, even though different might only be 18 months and then it'll fizzle and fall apart. We need to take that mantle and say, we're willing to disrupt ourselves much more aggressively over the next several years.
I love that idea of testing our assumptions. There's a lot of things that we believe have to be true because we're health systems, because we carry the overhead we carry, because we've done it certain ways, we're structured certain ways. We can't go into the next few years that way. We have to challenge the assumptions of how we do business and how we interact with our customers, our different stakeholders, our employees in new and different ways.
Very well said, both of you. Thanks so much. Good concluding thoughts. Thanks as always for sharing your perspective and sharing what you've heard.
Always fun, Trevor.
Thank you.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.